The number one issue with the patient hospital gown in any hospital that you go to is that patient's backside is revealed whenever they're walking around or rolling over in bed. So there's a sense of embarrassment and lack of dignity when you're trying to recover in the hospital. So while we're trying to appease the patients and the clinicians at the same time, we granted them access in the back where we've closed it for the patients, but we've created an access panel for any physician, whatever their need might be.
After the transplant, one of the first things they want you to do is get up and walk. You want me to do what? Well, the last thing I want to be worrying about is I've got that IV pole in one hand and my wife in the other arm is going down the hall worrying if my rear end is exposed. You know, I'm much less resistant to getting out in the hallway and walking if I've got that closed up in the front.
So we came up with a fun name for the hospital gown, and you know, it really talks to our heritage as a health system, Henry Ford, and what he did with the Model T and rolling that out on the assembly line and really changing the world of automotive. We've decided to call our patient gown the Model G. Carhartt makes quality products, and we wanted a quality gown for our patients. We spent the time to create the design, but we wanted to make sure that it was fabricated really well, because hospital gowns go through a tremendous amount of wear and tear in the laundry process. Over the course of several months, we were able to come to an agreement, and they'll be supplying Henry Ford Health System with 35,000 gowns. So if you look at the gown, it actually has no room for patients to be revealed or their privacy to be compromised. But then as you come up here, you have this access panel that actually opens up, and clinicians can have any type of access that they need, and then it just falls right on top of itself. So you can see we have a series of 8 snaps on the front and in 2 columns, and then you open up the gown and you have clinician access. And for smaller patients, you can move down to the smaller size so that they can have a more custom fit.
It's almost like a paper clip. At the end of the day, you look at that and you go, it's brilliant. It takes something very simple, and yet you now have elegance with that. So it is more comfortable, it is more dignified, and paradoxically, it's easier for us to use as healthcare providers.
I was here for many days and many nights, and that new hospital gown was maybe a little thing, but it had a big effect on making me feel that I was wearing something that I might even wear at home.